Hi, I'm Shelly Hornbuckle, and this is my friend Barbie, and we're gonna do a head, neck, and lymph node physical assessment. We're gonna pretend like Barbie is the correct ratio for a human being, and that she has a normal cephalic head. I'm gonna palpate her head, and I'm gonna look for any bumps or contusions, or where the growth plates don't meet her frontal, parietal, temporal, and occipital. I don't feel anything. I can check for infestations while I'm here. I don't see anything behind the ears, back of the neck. Yeah, she seems good. Okay. We're also going to check out her face for symmetry. She seems very symmetric to me. I can ask her to lift her eyebrows and open and close her eyes and to smile for me, and that would all show she had flaccidity on one side, which could indicate a stroke or a Bell's palsy. She does not have any of that. She seems very symmetric. Next, I'm going to check out her temporal artery. I'm going to check it for hardness and for pain. Doesn't seem to be causing her pain, and it doesn't feel any hard. Next, I'm going to go for the temporal mandibular, and I'm going to ask her to open and close her mouth, and that feels very smooth. No clicking or any um, roughness or noises there, so it's not abnormal. Um, it says to look for their mood when they walk in, that they're comfortable and that they're not anxious or angry, and she seems very comfortable for me. We're looking for periorbital edema. I don't see any of that. And nystagmus. So that's a fluttering in the eye that could indicate vertigo, and I don't see any of that. Next, we're going to go to her neck and see if it's symmetrical. It is. And we're going to do a range of motion. I'm going to do it for her since she has no body. I'm going to ask her to move her neck to the right and to the left and front and back. And she needs to do her chin to her chest. Now, if she had arthritis, there would be rigidity in that, and also pain would be noted. So far, she seems good with that. I'm going to ask her to raise her shoulders, and I'll push down, and that's to check cranial nerve number 9. She seems to be okay there. And always we're looking for swelling. Swelling indicates that there's a problem, some type of inflammation. And don't see any of that there. We should be able to see the carotid pulse at the top, but not at the bottom. And she seems fine there. We also have lymph nodes, and there's a lot of them. We have, um, when we're doing our lymph nodes, we don't want swelling once again. So we should just be palpating the area and not feeling anything. And if we palpate lumps or swellings in these areas, that indicates a problem, which can be infection, it could be anything. So we would have to look into that further. But we're gonna start at the preocular, and she seems fine there. And then we have posterior auricular. We have occipital. We have superficial cervical. We have submandibular, and then we have submental. We have a posterior cervical, a deep cervical, which we're supposed to be palpitating with a couple fingers down on both sides at the same time. It's just I was holding her head up. And we're gonna do light palpitation. We're gonna dig into her or anything. And super clavicular is right here. So she has no lumps or swelling in any of these areas. So they said that you could do one finger on this one, and then the rest are all the 2 to 3 fingers on a normal sized person. We're going to check out her trachea, make sure it's midline, and we can have her turn her head to the right and left, and then we palpate on the side that she's not turned on, and have her take a sip of water so we can feel it. Her trachea is fine, it's not shifted. Now the thyroid, you're not usually supposed to be able to palpate. Now, if you are able to palpate the thyroid. It could be enlarged. And then you would oscillate it for a bruit, which is a swishing sound. That concludes our head, neck, and lymph node assessment with Barbie. Thank you.